Fantastic. So welcome everyone. I'm so excited to see such a nice, big, full class here this evening. I'm very much looking forward to doing this next installment of yoga therapy for respiratory symptoms for Parkinson's. Again, so for those of you who may not know, although we do focus our protocols towards things that people who are living with Parkinson's might be concerned about. This is really a very open practice and is supportive for respiratory health in general. It takes into account some of the physical things that happen to people, sometimes with Parkinson's, particularly muscular spasms and rigidity that might limit some of the respiratory health. And so we do a little bit of work to open up the rib cage, open up the diaphragm, create space in the body. We want to be able to move the body and really connect with our breath so that we can relax the nervous system, so that we can be very supportive to our overall health and wellness. And so even if you don't have Parkinson's, if you have some other neurodegenerative disease, or if you're just interested in doing yoga therapy for respiratory health, or if you're a caregiver and you thought, hey, this would be a really great opportunity to connect and do some very gentle breath work, move my body a little bit. These are all really wonderful reasons to participate. And so thank you all for coming. I'm very excited to have all of you in here in the room. One more quick thing. Everybody, if you are not yet on camera, if you could please put yourself back on camera. It's just a safer thing for the shala. We just need to be able to kind of see who all is in the room. I need to be able to make sure that we're not doing an exercise and something happened and you need some assistance and whatever. So I just need to be able to see that you're in the room. So if your camera's off, if you could please turn your camera on. I'm going to go ahead and pin my video. So everyone's going to see my video primarily anyway. So you don't have to worry about everybody looking at you. They're going to see me on the video, but that's going to help us to be able to see what's going on from our end over here. Okay, so if you're doing any last minute things, please go ahead and turn your cameras back on as soon as you're able, because we're going to get started now. Quick thank you to the Parkinson's Foundation. We're really grateful to the Parkinson's Foundation for the grant that has allowed us to do this program and offer this programming to you 100% free. That's why we take a little bit of time to do all of this little admin stuff with getting everybody signed in. So I appreciate your patience. This really helps us to be able to demonstrate to the Parkinson's Foundation that we're keeping our commitment of getting the word out there, building these programs, making sure that people get access to these programs. So if you know of anybody who you think might benefit from these programs, please tell them about this. These are 100% free every single week, 4:30 on Tuesday. We'll be having these classes. So this is a year-long program. So lots of classes ahead for you. Every week it's on a different topic. And once a month, I'll be doing topic of respiratory. So without further ado, let's go ahead and get started. I'm going to ask everybody to grab their most comfortable seat in this moment right now. So I'm going to go ahead and shift. I was sitting on the floor to do my computer admin stuff, but I'm going to shift to a chair. And so if you have a chair that you're able to get to that feels comfortable for you, please make that transition. And you want to be able to sit in a way that is really supportive. Ideally, you want to be able to walk your feet a little bit away from your body so that your knees drop to the same level or below your hips. And we want to be able to have our feet connecting to the ground. And this just helps us feel supported and be able to sit up nice and tall. And so just finding that comfortable seat, you might move forward and back a couple of times or side to side. And just find that spot that feels neutral in the middle and sit tall. Wonderful. We're going to begin our practice today with an Om. And so you can keep your hands resting on your legs, or if you'd like to bring the hands in front of the body, pressing the hands together. Good. And we'll begin to take a few slow, deep breaths. And just noticing the body breathing, noticing any movement in the body as you breathe. Maybe in your belly, maybe in your chest. And then taking one big breath in. Completely exhale all the breath out of the body. We can blow out through the mouth. And then we'll breathe into Om. Big breath in. Very good. Go ahead and bring one hand to your heart, one hand to your belly. And we're going to do a little bit of very specific breathing into different parts of the body. So we're going to first work with breathing into the belly. So bringing all your awareness to your lower hand here on the belly. And just try to breathe in, let your belly get big like a balloon. And then as you exhale, pull the belly button in toward the spine. Good. Breathing in, the belly gets big like a balloon. And then exhaling, pulling the belly button back in. Very nice. We'll do 3 more of those. Big breath into the belly. Easy breath out, pulling the belly in. Breathing into the belly. Exhaling, pulling inward. Good. One more time. Big breath in. Easy breath out. Very good. Now we're going to add on to that. So we'll breathe first into the belly, let the belly get big. Then breathe bigger up into your heart, up into your chest. Good. And then completely exhale, emptying the body of breath, pulling the belly button into the spine. Breathing into the belly. Breathing into the chest. Completely exhale, pull the belly in. Breathing into the belly. Breathing into the chest. Completely exhale, pulling the belly in. We'll do that twice more. Breathing into the belly. Breathing into the chest. Completely exhale. Breathing into the belly. Breathing into the chest. And completely exhale. Very good. And then for just 3 rounds of breath, I'm going to invite you to take your hands away from your body, close your eyes. You can let your hands just rest on your legs. Close your eyes for a moment. And I want you to see, can you do that again without your hands on your body? So breathing first into the belly. Breathing big up into the heart space. Completely exhale, pull the belly button in. Breathing into the belly. Breathing into the heart. Completely exhale, let the breath go. One more time, breathing into the belly, into the heart. Exhale, release. Very good. So that just helps us to train what we call diaphragmatic breathing versus upper chest breathing. And we want to be able to breathe from the belly. That's diaphragmatic breathing, because that helps us to be more relaxed and it helps us to slow down and relax the nervous system specifically. So if you feel a little bit stressed, or you tend to get stressed, breathing deep and low in the belly can be very helpful. If you know that you have limited breath in general, then breathing first into the belly and then up into the chest helps us get a really big full breath. When we breathe just up into the chest first, we don't get that breath down into the lower part of the lungs, and we actually limit how much we breathe and can start to hyperventilate. So belly breathing is really important. All right, from here, we're going to do circle of joy. And so the idea of circle of joy is this is going to start to open up the rib cage a little bit more. We're going to get some movement into the body, and we're going to do all of these movements with the breath. So I'm going to turn sideways so that you can see me a little better. And we're going to bring the hands in front of the body, interlace the fingers, open up the elbows, take a breath in. Then we're going to press the hands away round the back, chin to the chest, big breath out. Breathing in, we're going to sit up tall. You can release the hands, reaching overhead. Exhaling, reach the arms down and back behind you. You can drop your head. Looking forward, reaching forward, big breath in. Bringing the hands back to heart center, big breath out. Good, we'll do that a couple times. Interlace the fingers, elbows up, breathe in. Exhale, press and round. Breathing in, sitting tall, reaching up. Exhale, reaching back, looking down. Breathing in, looking forward, reaching forward. Exhale, hands to the heart. Elbows up, breathe in. Exhale, press and round. Inhale, reaching up, looking up. Exhale, looking down, reaching back, reaching back. Inhale, reaching forward, looking forward. Exhale, palms press. Elbows up, breathe in. Exhale, press and round. Inhale, sitting tall. Exhale, reaching back, looking down. Inhale, reaching forward. Exhale, palms press. One more time, elbows up, breathe in. Exhale, press and round. Inhale, sitting tall. Exhale, reaching back. Inhale, reaching forward. Exhale, palms press. Good, take 3 slow, deep breaths here. Very good. From here, we're going to do a few just very gentle neck rolls. And so we're just going to move the neck in a lot of different directions, but we're going to do one side at a time, one movement at a time. So we'll start with rotation just by looking over your right shoulder. Take a breath in. And then as you exhale, look over your left shoulder. Take a breath in. Exhale back to right. Good, keep that going. Breathing in. And exhaling to turn the head. Do a few more on your own. syncing the movements up with the breath. Very good. And then coming back to center. Now we're going to do side to side. So the lateral movements of the head. So we're going to let the right ear drop toward the right shoulder. And we're just going to stay here for a moment. And just take maybe 3 slow, deep breaths. Maybe think of that deep belly breathing. Very good. And letting your head tip on over to the other side. Go nice and slow. And take 3 slow, deep breaths right here. Very good. And then gently coming back. Very good. Now we're going to do both that rotation and that lateral side movement with the whole spine. So we'll start with the lateral side movement here. And so I'm going to go ahead and back up just a little bit so you can see me a little bit better. And I'll back up the camera a little bit more too when we start to use work with the feet a little bit more. But for right now, I'm just going to move back a little bit. And I want you to just think of supporting yourself in these movements as best you can. So there's some options here. If you'd like to reach one hand behind the head, you can. Or you might find that just sweeping the arm up and over is going to make for a really good side stretch for you. So you'll decide, I'm going to do a hand behind the head, and I'm going to lean over to one side, and then maybe look up and away the opposite direction. If your arm is stretching and reaching, it'll just look like this, reaching out through the fingertips. Stretching up and over. Very good. And then we'll do the other side. Come back to center. The other hand can come behind the head, or just reaching up and over, leaning the other way, looking up and away. Very good. And then coming back to center. And now we're just going to go side to side a couple of times. So we're going to do this with the breath because this is about breath work. So we're going to use the breath to guide our movement. So we'll breathe in to reach up and over. And then exhale to come back. Breathe in the other way. Exhaling back to center. Going back and forth a few times, moving at the pace of your own breath. Very good. All right, so just coming back to center. Now we're going to do some twists. So rather than just looking over our shoulder, we're going to twist the whole spine left and right. So we're going to begin first by moving with the arm each direction. We'll start on one side, and then we'll do the other side after we've done a few rounds. And then we'll do a longer hold on each side. So breathing in, your right arm is going to reach back into the space behind you, look back, stretch back, reach back, big breath in. And then as you exhale, you'll reach it up and away across the body, up and away. Breathing in to open. Exhale to twist. Breathing in to open. Exhale to twist. Good. 3 more. Very good. And then coming back to center, we'll do the other side. Left arm is going to reach back this time. Stretch back, reach back, look back. And then exhale up and away. Breathing into open. Exhale to twist. Breathing into open. Exhale to twist. Very good. Do a few more at the pace of your own breath. Very good. And then coming back to center. Now we're going to do a longer twist on each side. So we're going to take our right hand. We're going to bring our right hand to our left knee. Then you're going to bring your left hand somewhere back behind you, maybe to the seat of the chair. And you're going to look over your left shoulder, sitting up as tall as you can. Take 3 slow, deep breaths right here. Very good. Coming back to center. We're going to go the other way. Left hand is going to come to the right knee. Right hand is going to reach somewhere behind you, maybe to the seat of the chair, maybe to the back of the chair. Looking over your right shoulder, sitting up as tall as you can. Taking 3 slow, deep breaths. Very good. And then coming back to center. Wonderful. Okay. So now we're going to do a little bit bigger movements in the spine. We're going to do a seated sun salutation, and then we're going to focus a little bit more on some specific pranayamas. So we're going to do the seated sun salutation followed by a few very specific pranayamas. And pranayamas are any breathing exercises that are traditional to our yoga practices. And so I'm going to go ahead and scoot back a little bit and tip my camera down so you can see my feet a little bit better. I'm going to scoot back into the space. Tip this down a little bit more. Excellent. Okay. So what we're going to do is we're first going to begin by big breath in, reach the arms up and overhead. You can look up. And then as you exhale, we're going to bring our hands back down. You could bring them just to your knees, leaning forward, or you can walk your hands all the way to your feet, dropping your head. Taking a breath in, we'll sit back up, pick your right knee up, hold on to the right knee. And then on the breath out, bow your head. Big breath in, let go, reach up, look up. Big breath out, touch your toes. Big breath in, sitting up, left knee lifts. Big breath out, bow your head. Big breath in, reach up, look up. Big breath out, forward fold. Big breath in, sitting up, right knee lifts. Big breath out, bow your head. Big breath in, reach up, look up. Exhale and forward fold. Big breath in, sit up, left knee lifts. Big breath out, bow your head. 2 more rounds. Big breath in, reach up. Exhale, forward fold. Inhale, right knee lifts, sit up. Right knee. Exhale, bow your head. Inhale, arms reach up, look up. Exhale, forward fold. Inhale, left knee lifts, sit up. Exhale, bow the head. Last round, arms up, breathe in. Exhale, forward fold. Inhale, right knee lifts. Exhale, bow your head. Inhale, arms up, stretch up. Exhale, forward fold. Inhale, left knee lifts. Exhale, bow the head. One more big breath in, reach up. Exhale, hands to the heart. Very good. I'll go ahead and come in a little bit closer here. And we're going to do a few breath work practices. We're going to start just with a specific practice that usually we just refer to as box breathing or square breathing. And so what we're going to do is we're thinking about all 4 parts of the breath: the inhale hold, the exhale, and the exhale hold. So there's 4 parts to your breath. You breathe in, you hold, you exhale, and you exhale, hold. So there's 4 parts to the breath. We're going to try to make all 4 parts of the breath the same length of time. So we're going to start with a count of 3. I'm going to guide the count. And then after we do this count of 3 a few rounds, you'll have an opportunity to change the count. So if you want to make the count longer, you can. If you feel like, wow, 3 at each thing was kind of a long time, you want to make it shorter, you can make it shorter. But try to stay with me for the first couple rounds at a count of 3. Okay? And so you're not going to be plugging your nose or anything like that. We'll get to all that stuff later. So just let your hands come to rest. The invitation is to breathe in and out through the nose because that helps facilitate that belly breathing that we talked about before. But we're paying attention to how long we're breathing in, how long we're holding the breath, how long we're breathing out, how long we're holding the breath out. Go ahead and take 1 full breath in to begin. Completely exhale. And then we'll begin the practice. Breathing in for 1, 2, 3. Holding for 1, 2, 3. Breathing out for 1, 2, 3. Holding the breath out for 1, 2, 3. Inhale, 1, 2, 3. Hold, 1, 2, 3. Exhale, 1, 2, 3. Hold, 1, 2, 3. Keep that going. Inhale, 1, 2, 3. Hold, 1, 2, 3. Exhale, 1, 2, 3. Hold, 1, 2, 3. Inhale, 1, 2, 3. Hold, 1, 2, 3. Exhale, 1, 2, 3. Hold, 1, 2, 3. And then just allow yourself to return to normal breathing. Okay, that was our first practice at square breathing, box breathing. And so now we're going to do it again. We're just going to go into a moment of silence. If you'd like, you can close your eyes for this. And if you think that you can hold the breath in or breathe in and out a little bit slower, you can make the count a little longer. If that felt challenging for you and you want to count just to 1 or count to 2, that's also fine. We're going to do this for about 2 minutes. And so when you're ready, you can close your eyes and begin counting all 4 parts of the breath for a few rounds of breath, beginning now. Go ahead and finish up whatever round you're on. And then coming back to center. Good. All right, we're going to do a few more movements in the body just to continue to open up the rib cage, open up the hips for deep belly breathing, open up the side body. And so we're going to do a series of movements and then we're going to come back to a few more pranayamas. So this is kind of how we're going to do this. We'll go back and forth a little bit, because that helps us to utilize the breath to open up and take it slow. And as we get a little bit more warmed up, we do bigger shapes. So we're about to enter a few more bigger shapes. So we're going to do revolved chair pose, seated squat, and then an extended side angle and reverse warrior. So we're going to do all of these seated from a chair. And so I'm going to go ahead and scoot back again so that you can see what's happening with my legs here. Because what's happening with the feet is going to be important. All right, I'm going to turn a little bit at a diagonal. So my feet are pointing directly out in front of me. Both of them are resting right in front of me. And I'm going to come back into that movement like we did that forward fold, but I'm just going to reach just my right hand down toward the floor. Just my right hand. If you can't get your hand all the way down there, you can also let your arm come to rest in a cross position over your legs. We're going to reach our left hand up into the air for a nice big twist. Take a couple of breaths here. Very good. And then coming back to center, we're going to do the other side. So again, either coming all the way into your forward fold, now reaching the left hand down to the floor, or crossing that left hand over both legs. Reach your right hand high. Big stretch up. Take a couple of slow, deep breaths. Very good. Coming back to center, sitting up nice and tall. Now we're going to take our feet wide apart. So you're going to step your feet as wide apart as you can, and you're going to point your toes out toward the side. And you're going to get some big opening in the inner thighs here. And go ahead and take your hands, press them inside your legs, and almost push your legs open a little more. See if you can push your legs open a little bit. Very good. And then we're going to come into a side movement here by bringing our right elbow down onto the right thigh and reaching our left hand high. Big stretch up. So it's very similar to the movement we just did, only now the legs are open. Big breath in, easy breath out. Very good. Go ahead and come on back to center. Now the left elbow is going to come onto the thigh, onto the left leg. Right hand is going to reach up into the air, looking up, stretching up. 3 slow, deep breaths. Very good. Go ahead and come on back. Now we're going to straighten one of our legs at a time. So keep your right knee bent, and you're going to just stretch your left leg out a little bit further. So straighten the left leg and try to get your whole foot to go flat to the floor. Left foot goes flat to the floor as you stretch the leg out. Now, leaning your right arm onto your thigh, reach your left arm up and over your ear. Big stretch over, extended side angle pose. 3 breaths here. Excellent. Everyone looks really good. Go ahead and sit up. Keep your legs right how they are. Left leg is straight, right knee is bent. But now you're going to reach your left hand down that left leg. Reach down the left leg. Reach your right hand back up to the sky. Big stretch up. Look up. Breathe in. Maybe reach that right hand up and over to the left, reaching back over to the left side. Very good. Give that big stretch through the right side of the body. And then slowly come back. Slide that hand up the leg. Bend that left leg. And we'll do the same thing other side. Right leg stretches out. Straighten the right leg. Try to get those toes flat to the floor. Try to get the whole right foot flat to the floor. And then bring the left arm down to the left leg. Reach your right arm up and overhead. Extended side angle pose, softly breathing. Have a little smile, make it look easy. Wonderful. Go ahead and sit up. Keep the legs right how they are. Right leg stays straight. Left knee is bent. Slide the right hand down the right leg. Left arm reaches up into the air. Maybe stretching up and over to the right. Softly breathing. Good. Coming on back. Releasing out of whatever you got going on. Just allow yourself to come back to center. You could bring your feet back in together. Wonderful. And we have just a few more practices to close our practice today. We're going to do a few more pranayama practices. So we're going to start with one of my all-time favorites, lion's breath. This one helps us to, let go of all of that ego, not take ourselves so seriously. It can provide a cathartic release. And one of the things it also does is just release tension in the body. So when we think about releasing emotional tension, we're also releasing physical tension. So if you got lots of tight muscles, places that are spasming, this can help create a little reset and let that go. Okay, so what we're going to do is we're going to take a big breath into the belly, hold the breath in, and then we're going to take a big breath out through the mouth, stick out the tongue, and make some sound. Very good. We'll do a couple of these. Big breath in. Hold. Big breath out. Good. We'll do 3 more. If you want to get your arms involved, you can get your arms involved as well. Big breath in. Big breath out. Big breath in. Big breath out. One more. Big breath in. Let it go. Very good. I moved a couple of the pranayamas around because I thought this would actually be a better order. So the next one we're going to do now is Kapalabhati breath, skull shining breath. And this one is just a really fast exhale, almost kind of like you're blowing your nose, but you're pumping the energy from your belly. So we're going to take a really strong pull of the belly button into the spine. So I'm going to tip the camera down a little bit so you can see that the movement is happening from my belly. I'm going to keep my hand here. If you want to keep your hand here, you can do that as well. We're going to take 10 really fast exhales. Don't worry about breathing in. Your body will breathe in on its own. So just 10 really fast exhales. Begin when you're ready. Good. Take a couple of regular breaths. And then we'll do that again. Big breath in to begin. 10 really fast exhales. Good. Take a couple of regular breaths. And one last round. Big breath in. This time, if you want to do 15 or 20, you can go a little longer. You can begin. Good. Everybody looks really good. Go ahead and take a few regular breaths and just notice that they may have brought a little heat into the body. You might have felt like there's some energy in your system. You might have gotten even a little dizzy. So if you got a little dizzy, make sure you take a few slow, deep breaths. Let your body re-regulate. And then we're going to do a few cooling breaths now. So we're going to do 3 breaths. We're going to do alternate nostril breathing. So this is where we're getting a little hands on the our fingers on the nose, alternate nostril breathing. We're going to do Shitali and or Sitkari. So there'll be options there. That's the cooling breath where we suck the breath in through curled tongue or in through the teeth. We'll walk you through it. And then we're going to finish with Brahmari breath, bumblebee breath. Okay. And this is going to be our whole practice for today. Okay. So we'll begin with alternate nostril breathing. Go ahead and block your right nostril. Breathe in through the left. And then switch, breathe out through the right. In through the right. Out through the left. In through the left. Out through the right. In through the right. Out through the left. One more time. In through the left. Out through the right. In through the right. Out through the left. Very good. And now we're going to do Shitali or Sitkari breath. So this is the cooling breath. So there's 2 ways that you can do a cooling breath. If you're able to stick out your tongue and curl your tongue like this, go ahead and try that. Sometimes people's tongue, just their anatomy, that doesn't work. So if that's not you and you can't do that, then I'm going to invite you to smile and show your beautiful teeth. And we're going to sip the breath in through either through curled tongue or into the teeth. Then you're going to take your tongue, you're going to put it to the roof of your mouth and breathe out through your nose. Good. In through curled tongue or into the teeth. Tongue to the roof of the mouth, breathe out through the nose. In through curled tongue or in through the teeth. Tongue to the roof of the mouth, breathe out through the nose. Two more. Very good. You may have noticed cold air going into your mouth, into your body. You may have noticed your body temperature drop a little. This is a cooling breath. Very good. And then we're going to do our final breath, the bumblebee breath, Brahmari pranayama. And this is a humming breath. So you're just going to be humming into your head. Options here, if you feel like covering your eyes, plugging your ears, plugging your nose, you can do all of that. You can also just close your eyes or maybe just cover your ears if that feels more comfortable. Or you can just make the humming sound. So you'll decide what version of that you want to do. We're going to do 3 of them. I'm going to do the full thing just for demonstration, and you decide which version you want to do. We'll do 3 of them together. Big breath in. And then on the exhale, humming into the head. Hum. Two more. Hum. Fantastic. Thank you so much for joining us in this practice today. We'll close our practice with one collective Om. For those of you who I asked if you would mind staying after, if you don't mind staying for just a moment so I can just check in with you, Barbara, Brenda, and Richard, I would just love a moment to chat with you. Anybody else who'd like to stay, you can also stay. And we'll close our practice with our Om. Big breath in. Namaste. Thank you, everyone, for sharing in this practice this evening. Thank you again to the Parkinson's Foundation, and thank you for Om Hum Shala for giving me the opportunity to share this practice with you.
Thank you.
Evening.
Thank you.
Bye, everybody. I'm going to go ahead and stop the recording.